You've been planning pregnancy. You know when was your ovulation and you had sexual intercourse during your fertility window? Or maybe your arm fertility treatment? Or maybe you just worry. Anyway, you really want to know if you're pregnant or not, and you want to know it as soon as possible. Pregnancy tests work by detecting HCG. HCG is a human chorionic gonadotropin. It's a hormone which your body produces during pregnancy. So, to answer the question, how early could you know about your pregnancy, we need to know how early your body starts to produce HCG. After the ovulation, when the egg is released from the ovary, it goes to the fallopian tube where it's going to be fertilized by the sperm. Fertilized egg is called zygote. Zygote starts to divide, and while dividing, it's traveling down the fallopian tube to the uterus cavity. Zygote will divide into the blastocysts. Blastocyst is a ball of cells which contains inner and outer group of cells. Inner group of cells is called embryoblast. Embryo will develop from these cells. And the outer group of cells is called trophoblasts. Trophoblast is going to be a part of the placenta in the future. So trophoblast is a group of cells which nourish in the embryo. Blastocysts attach to the uterine wall and invade into the endometrium. This process is called implantation. After the implantation, trophoblast starts to produce HCG. Implantation can happen as early as 6 days and as late as 12 days after ovulation. So you can find out if you're pregnant or not earlier than in 6 days after ovulation. But of course, you shouldn't expect your home pregnancy test will be positive just the same day as implantation happened, because HCG needs some time to increase, and that's why I wouldn't recommend pregnancy testing earlier than in 8 days after ovulation. The earlier you take home pregnancy test, the harder it is for the test to find HCG. There are some early pregnancy tests that can tell if you're pregnant as early as 6 days before your missed period, but not all pregnancies could be detected that early. If you have your test negative, don't be upset. Maybe you are pregnant, but for now, your HCG level is not enough for test to detect it. So just repeat the test in a few days. The best time to make pregnancy test will be from the day you have missed your period, because that's when you'll have more reliable test results. And it's better to make test in the morning when your urine is concentrated, because there will be a bigger amount of the hormone in it. You might have false negative test if you're checking for the results too early, or if you didn't use it correctly, or maybe if you used an expired one. Also, it might be wrong because you miscalculated your cycle and you're wrong about the conception date. Ectopic pregnancy might be a reason for the false negative test, so you really need to pay attention to the symptoms that you have. Abdominal pain, pelvic pain, sudden vaginal bleeding, and especially if it's combined with fainting, with extreme dizziness, if you feel nausea or if you're vomiting, maybe you have shoulder pain, that's a reason for you to immediately contact your doctor and go to the emergency room. Pregnancy test result, as well as false negative, could be false positive. You might have false positive test if you just gave birth, if you just had a miscarriage or termination, if you have some ovarian cysts or even some types of cancer, also in postmenopause. All the given information is for educational purpose only. So if you have any questions, if you have any doubts or symptoms, you need to make a doctor's appointment. Thank you for watching this video. I really hope to see you soon in my next one. Bye!